Thanks, Jess.
Yeah.
So I realize we're approaching the end of the day on the East Coast, so I want to thank you all for sticking around for our presentation today. My name is Kathy Ho, and I am the licensed clinical social worker. I am the clinical supervising social worker at the Mills Legal Clinic at Stanford Law School. So I supervised social work interns at Fordham Law School's clinic for 9 years before coming to Stanford and joining them approximately 3.5 years ago to launch and develop the Legal Social Work Collaborative. Jess?
Hi, my name is Jessica. I am a social work intern at the Mills Legal Clinic this year, working with the Youth Education Law Project and the Criminal Defense Clinic. And I am an MSW student going into my final year at UC Berkeley and a budding forensic social worker.
So we're here to tell you folks about our almost 4-year pilot project at Stanford Law School. Now, the purpose of this pilot project was to provide law students and social work students with opportunities to learn effective collaboration across professions. So those of us who have been practicing in our professions for a while know how important this skill is. And I know that when I was a new social worker, I was thrown into work settings where it was assumed I knew how to work on interdisciplinary teams, but I really had to learn as I go. So this has provided a structured opportunity to learn and practice collaboration across disciplines. So from the beginning, we've been rather data focused on collecting client data regarding social determinants of health, which I will call SDOH for short because that is quite the mouthful. We've also been tracking social work activities and time in our administrative data, which is tracked in Clio, which is our documentation application. And we've also been getting feedback from law students regarding their perceptions and experience with the social work interns and the collaboration. So today we'll be sharing some results from the client's SDOH data gathered from using the Prepare screening tool, the administrative data from Clio, and the law student survey data, and what we've learned from this entire experience. And we'll be reporting frequencies in the data, and we haven't done any type of inferential statistics or analyses as of yet. So on this slide is a photo of our law students working at the community law clinic, which is located in the community. As you can see on this slide, at MLC, or Mills Legal Clinic, our holistic representation model has our social work interns embedded in 4 direct practice clinics, which are the Youth and Education Law Project, the Criminal Defense Clinic, the Community Law Clinic, and the Immigrants' Rights Clinic. And each of these clinics cover several different practice areas or kind of sub-practice areas, which are listed here on the slide. So COVID-19 pandemic, well, that kept us on our toes. It really forced us to pivot to a completely virtual format in March of 2020 during our first year of hosting 2 interns. And then we had to pivot again to a hybrid format in September of 2021 when we had our 3rd cohort start, which consisted of 5 interns, which is Jessica is a part of. So during this 3.5 year process, we've established MOUs with 11 schools of social work, which really allows for a larger pool of social work students to draw from. This includes both traditional and online programs. And we've been fortunate enough to primarily obtain our students from SJSU, San Jose State University, and Cal, which is UC Berkeley, as well as 2 other MSW programs over the past 3 years. Each of our interns have been theoretically completing 24 hours a week. I think Jess would agree that it's probably a lot more than 24 hours per week because our interns are so dedicated to the work that they do in serving our clients. And as we mentioned, with COVID-19, it's really kept us on our toes in terms of being able to be really nimble and change according to the public health requirements. So these are the 3 sources of data we'll be presenting today. The client data we've collected regarding the SDOH, social work activities and timekeeping that we've been tracking, and the administrative data, and the law student feedback from the anonymous online surveys we've been administering through Qualtrics. So PREPARE stands for protocol for responding to and assessing assets, risks, and experiences. That's an absolute mouthful, so prepare is much easier to say. But we selected this tool because we decided to use this free screening tool for the purposes of screening clients for social work needs. Now, this tool was developed by community public health agencies, and it was important because they really took into account social determinants of health and how important that those are in affecting clients' health outcomes and well-being. So health is not just defined by the absence or presence of disease, but really there's a context and our clients' environment and the various systems that interplay in their lives that impact their health and well-being. So we chose a prayer tool because it was developed and validated using 8 gold standard stages of measure development. And it really recognizes the interconnectedness of systems and how stressors in one system can have this ripple effect or domino effect in other systems that impact our clients' lives. So what we did with this form was we adapted it into an online Google form for the social work interns to complete for each client right around the time of referral. And as you can see from this form, it includes demographic questions and questions about access to various resources, including education, food, childcare, healthcare, transportation, housing. Now, what was nice about putting in a Google form was that when you enter all the information, it automatically then populates all the data into a Google Sheet, which is also compatible with Excel. So that makes looking at the data and summing it up and looking at frequencies a lot easier. So over the course of this project, we served 102 clients. I'm sure this number pales in comparison to the number of clients served by public defenders' offices. However, at Stanford Law School, our very small practice, it's a very, very small practice because it is primarily, the work is driven by the students. So we're really quite proud of the number of cases our small but mighty group of social work interns have worked on. Our referrals primarily came from 3 of the 4 clinics that we were embedded in. And they were pretty evenly distributed among these 3 particular clinics. So the Youth and Education Law Project, which we affectionately call YELP, and the director of that clinic will always tell you that they were the first to use the YELP acronym, so they really should have trademarked or copyrighted it. But YELP referred 32 clients to us. The Community Law Clinic referred 29 clients. The Criminal Defense Clinic referred 28 clients. And the Immigrants' Rights Clinic referred 11 clients to us. And we also did some brief consultations for 2 cases in the Religious Liberties Clinic. So this slide shows the number of SDOH needs our clients indicated around the time of referral. Now, often when the lawyers or law students refer clients to us, they have something that they've identified as an issue that's in need of social work support for the client. But typically, what we found was that the majority of clients have needs beyond their presenting legal needs, and many have 3 or more areas of need in which they could benefit from our support. So along the right, you'll see that the most common access needs our clients indicated during the screening process consisted of medical and mental health needs. That was 60% of clients indicated that particular need. Education access was 43%, which makes sense because so many of our clients were referred by the Youth and Education Law Project. And of course, housing instability, which is 32%. And I want to say that we cannot miraculously find housing for clients. That is a nearly impossible thing to do, especially in California. But we do work with clients that have housing instability and trying to identify how they can access shelters and possible affordable housing options and get on a wait list and receive additional assistance. And then 37% of our clients identified other needs that weren't directly asked about in terms of concrete questions in the prepare form. And so those needs we address kind of as an ad hoc as needed basis.
Great, thanks, Kathy. So I'm going to pivot to talking about our Clio data. So Clio is the case management application that we use to track our activities, write our case notes, and track how our time is spent. And this is a list of social work activity categories and how we operationalized each one. So below each main heading is the inclusion criteria for tasks that fit within each category. And this is not an all-encompassing list, but rather highlights the tasks that are really client-centered. And to give a little bit of clarification on some of these. So a client meeting was defined as any client interaction that lasted for over 30 minutes. Client contact was anything that was less than 30 minutes. So you'll see that in a later slide. Consultation was defined as any meetings that included the law students. So anytime we're interacting with them, talking about a case or interacting with the supervising attorneys. Case management was any time we were calling the agency to make a referral or sending resources to clients. So when there was an interaction with a service provider, an agency, or a client. And then research is the background work required to make those referrals and connect the clients to the resources. And so this is giving an overview of social work tasks allocated per case. So as Kathy mentioned, we served 102 cases on which we either consulted or provided direct practice to. Of those, 81 of those clients were direct service cases, so we had closer involvement with the clients. So you can see that for most of those direct service cases, we were providing services in most of these categories. In particular, we're doing a lot of research, a lot of document review, a lot of case management, and a lot of direct client work. And so we're going to go through each year and kind of talk about the breakdown of how time is spent. This is showing the total hours spent on activities between 2 interns. So for year 1, we had 2 interns on board, and the frequency of some of those social work tasks according to how many touch points were entered. So the graph is showing how much time is spent on each activity. And then at the end, this is kind of an average of how much time was spent, how much frequency was spent on each of these categories. So for example, consultation had 109 touch points, which averages out to every other day consulting with the law students. Case management was on an average of twice per week. 1 to 2 times per week, someone's having a client meeting. 1 time per week, client contact. And every month, one of the interns is attending an IEP or a hearing. And for context, this year in March was impacted by the COVID-19 pandemic. So everything was shut down and moved to remote, which definitely impacted and changed the nature of the way that the work was done. Year 2, 2020 to 2021, this had 5 interns. And you can see that some of the allocations for work have changed a little bit. This was also an entirely virtual year. So despite that, interns were still able to have very frequent client contact and frequent consultation with the law students. And you can see that that has really increased. So client meetings were now 2 per day. Case management was on average more than once per day. Consultation was daily with the law students. Client contact was every other day, and IEP meetings or hearings were every other week. So really increased in terms of frequency. And then year 3, this was the hybrid. So, and this is the year that we're still currently in. So 2021 to 2022, this year interns have been doing 2 days in person and 1 day remote. And this is also data that's still in process of being collected because we haven't yet finished our final quarter. So the hours are lower because we haven't yet accrued all the hours that we're planning on accruing by the end of this final quarter that we're in. Client meetings are still by far the most frequent, 2 times per day on average. Consultation is daily. Case management is happening 1 to 2 times per day. IEP meetings or hearings are being attended every other week, and client contact is happening every other day. So you can really see kind of the frequency of interaction that's happening and how that has grown over the past 3 years. And so moving to law student survey data, this survey has been administered since spring of 2019, so spring of the first year of the pilot, spring being the year that Kathy was the main contact for social work at the clinic. So we've collected 9 quarters of data. We used a Likert scale and open text question style, and this was anonymous, delivered via Qualtrics. We have received 107 responses total over those 9 quarters. and have been gathering feedback from that to inform our program development over time. So this is just showing prior experience with social work that any of the law students had coming into the clinic. So only 35% said yes and 64% said no. So the majority of law students were coming in with a lack of understanding of our role, which then tasked us to kind of portray and communicate to them what the social work role was on the team. And really, we had the chance to kind of make this first impression of what social work looks like in a legal setting, which is kind of cool. And so this is showing the frequency of consultation. 20% of the respondents said that they hadn't had a chance to interact with social work. But among those who did have a chance to consult with social work, 76% had 3 or more meetings with social work. So showing that integration piece that was a part of our involvement. And I will also note that the overwhelming majority of those who consulted with social work reported that social work was always responsive, which is notable because social work was only working 24 hours a week, as Kathy mentioned, whereas the law students are working full time when they're in the clinic. And 100% of the law students who responded to this survey reported that social work was available when they needed them, which is huge. So is this collaborative ultimately beneficial to law students' development and the clinical legal education? According to our survey, we've received an overwhelming amount of support. Law students have agreed that this interdisciplinary collaboration has helped advance their client needs and goals. It has helped increase advocacy on behalf of their clients. It has helped with their own professional development and has added value to their legal education, and this is all at over 95%, so the overwhelming majority. And this is including those who reported that they did not have direct social work consultation, but likely interacted with social work during case rounds or other opportunities to kind of listen to the expertise that we're bringing to the table. And this is showing the most common reasons for social work consultation according to the law students. So we looked at the breakdown of how law students viewed the reasons for their consultation with us. And this is among the 85 law students who consulted with social work. This question was asked to, and these are the most common reasons. So you can see that the top 2 are for social service needs and communication with clients, which really shows how frequently social work was utilized for that client engagement piece and for providing services to help meet the goals of holistic representation. So our big takeaways, there is clearly a need for social work. Clients have needs, as Kathy spoke about earlier, that go beyond the reason for legal consultation, with the top 3 being medical and mental health access, education access, and housing instability, which are all areas that really call for that social work involvement. We also have received an overwhelming positive reception from law students saying that the social work collaborative has really enhanced advocacy, enhanced their clinic experience, enhanced professional development, and has really helped round out the client goals and client needs that we're hoping to address while they're accessing services through us. And then the big through line for social work was this emphasis on interactions, communications, and building bridges between professions, between clients and law students, providers, etc. Client interaction has really been central to the social work component and central to the effectiveness. Much of the time was spent on client communication and case management, as demonstrated in both the CLIO data and also in the reasons for social work consultation that law students reported. There's weekly communication with clients happening, nearly weekly meetings with, nearly weekly longer meetings with clients, and then daily consultation with the law students, which really shows kind of how involved we are in that communication piece. And social work is really serving as a liaison and tool for integration and increasing that connectedness and effectiveness of this holistic representation that we're providing. And so the biggest takeaway really is that social work is indeed supporting the mission of holistic representation, and that has been shown in all the data that we've collected.
Thanks, Jess. So lessons learned. I think one of the most important lessons for us has been the importance of collecting more granular social work data, which can really aid in determining staffing needs and caseloads. This data can inform client needs as well as gaps in services, funding for expanding programs, hiring social workers, managing caseloads, taking on social work interns. We've also been developing a tagging system that was inspired by a conversation I had with Rebecca Whittam when she was at the Bronx Defenders. And so this is a tagging system that we've been working on within our documentation so that we have even more granular data about specific tasks that our social interns are engaged in. However, because this is really the first year of implementation, we really don't have a lot of data to present on it. So we didn't present on this particular more granular data that we've been collecting. Another lesson, social workers provide a lot more than just linkages and referrals. So beyond just making referrals, we've talked about some creative ways to utilize social workers and more fully utilize their skill sets. I want to just highlight one example that Jess, in terms of Jess's case. So Jess was working with a client for the criminal defense clinic, and she was working they were partnering with the Federal Defender's Office here in San Francisco, and she was meeting with a client and gathering information from her client about his job prospects and barriers to gainful employment. That directly, and by gathering this information, she brought it back to the team, and this information directly affected the theory of the case for the client's motion for early termination and supervised release. And so it ended up being a successful motion and was a direct result of Jess's interviews and identifying relevant information that provided the team with a compelling reason for the judge to grant the early termination request. So that was a great example of how to utilize social workers in ways that are more than just providing referrals. Also, trauma-informed practice has been quite the buzzword lately, but integrating trauma-informed and restorative practices to more effectively engage and collaborate with clients is really important and part of the holistic representation process. Again, with all the touch points with the interns interfacing with the clients, being able to integrate these approaches really has helped to establish rapport and trust and more effective working relationships with clients. Also, client-led holistic practice. So this really recognizes that clients often have needs that really eclipse the presenting real issue that they present with, and that by addressing these needs, by addressing these clients' needs, is beneficial both to the client and the legal case. So it's not like it's outside of the legal realm or not applicable. It actually enhances the client's ability to participate in the legal case. Because we're able to address these other areas that are impacting their well-being. Also, in terms of the importance of creating a pipeline of trained social workers who are prepared to successfully collaborate with lawyers in indigent defense settings. We need well-trained social workers to fill these positions that are becoming available. Here in California, more and more offices are hiring social workers. And so as this model gains more traction in even law schools, it's important to be able to have social workers and the settings to train social workers. So this really is a valuable learning opportunity, valuable to law student training, valuable to the training of social workers and social work students. And this really is an innovation in preparing the next generation of advocates.
So this is just a final page of quotes that we got. We had a couple questions at the end of our law student survey that were qualitative, asking for feedback and asking for any final comments on their experience with social work interns. And I'm just going to read these aloud. One person said, our social work intern was great. She was really part of the team. Whenever we had a potential need or concern that she could address, she was immediately on it and had ready solutions. She really tried to understand our client, and we would not have been able to provide holistic representation without her. We couldn't have accomplished what we did with our social worker. So grateful for their contributions and their hard work. And finally, a law student said, 50% of my learning this quarter came from my clinic work. The other 50% came from social work. Thank you so much. That's all.
Thank you guys so much. We do, that was a terrific presentation, really, really interesting. And I know that, well, I was just, I was reliving the past 3 years as you described the sort of changes in work and patterns and location of everybody. We've got several minutes left, so people should just go ahead and pop their questions in the chat or unmute if you're comfortable doing that.
I'm just going to make some noise. Just wonderful, excellent work. Woo, woo, woo. All right.
Thank you.
Thank you, Larry. I see a hand up from Paul.
Yeah, I had a good question. You know, if you're working in a smaller county where you're having to make a choice between a mitigation specialist or a social worker, what are the main questions you think you should be really reflecting on? I mean, just seeing the data that you had, you know, to really determine which is the most effective, you know, for your office or for your needs. What are those basic questions you think we should really be looking at as we're trying to budget for one of those positions?
Yeah, I mean, I think one of the things to first kind of wrap our heads around is what is the scope of practice that you want this person, you know, in terms of this person's functioning. Like, I know that there are a lot of mitigation specialists out there who are social workers. So it may be that you get that, and a lot of the social workers who work in public defenders' offices are doing this mitigation type work. I mean, what I love about social work is that because our training really comes from understanding the person in their environment, right? And understanding that, you know, no one exists in a vacuum and there's so much, and context is so important. And that's why, you know, from a social worker, and me, of course, I'm being biased because I'm a social worker. But, you know, I think as social workers, because of our generalist training and our approach to working with clients in a more holistic way, I think we are very methodical about gathering information and getting this context and doing all this research and putting the pieces together to really tell the client story in their words. So I mean, I don't have like a go-to answer for you, but I think it really depends on the needs of your office. Like I said, you have a small office, and so, you know, what's the scope of practice you see for this mitigation specialist or the social worker, and you know, and if you're able to find a social worker who's also does mitigation work or vice versa, I think you hit the jackpot there.
Thanks.
I'm curious if the public defender offices there. I mean, I know you guys probably not everyone is staying right near you guys or even in California necessarily, but is it very common to have social workers there? I know in Indiana, like we would love for it to be common, but it is quite rare for public defender offices to have a social worker at all. So I'm curious if that's something that's like changed recently or is changing now, or any comments you can make on that.
Absolutely, there has been recent changes. You know, I know when I used to teach and work in New York, you know, with the Bronx Defenders and Neighborhood Defender Services being there, that is a very common model in New York City. And I know back in, my gosh, 2012 or so, we didn't have social workers in the public defender's office as frequently as we do now. So oftentimes social workers would be in, say, the youth office or working with youth, but not across the board, you know, across the different departments of adults. Now in California, you're seeing more and more public defenders offices with social workers. And in fact, the most innovative public defenders offices do have social workers now. And we're finding that more and more these offices might start off with 1 or 2 social workers and then are expanding their programs. So they're seeing that once you bring on a social worker, there is increased need and definitely a capacity And so being able to develop that capacity to expand to include more social workers and to bring on social work interns, right, to kind of create this pipeline of social workers who can then graduate and fill these positions that are opening up in all the different counties is really important. So, I mean, I definitely see that as a trend in California. I hope that's also a trend in Indiana and maybe that and in other states. But I think it really shouldn't be a luxury, because I think it's important to really have social workers there to provide that kind of holistic support, that practical support to the clients, but also contribute as really important members of the legal team.
Yeah, I would add to that and say that, you know, I think the benefit of having social work embedded within an office is that you are a member of the team rather than just a consultant. And, you know, even though we were categorizing our interactions with law students as providing consultation, we're really a part of the legal team. And so we're debriefing and we're having discussions about what best to do, you know, given a client situation, right? And so that really changes the dynamic in terms of the services that you're providing to the client, the way that, you know, you really are part of the team rather than consulting or providing a specific report or a specific, you know, resource. You're really there for the whole process. And I think that really changes the way that clients are served. And I would say that to go to Scott's question just briefly, I would say that that is the big benefit of having interns alongside law students. And I think the extra benefit is that you're kind of bringing in that integration at a really early stage, right? Like these are budding social workers and these are budding law students, or budding lawyers rather. And so you're getting that introduction and getting that communication from the very start. And so then it becomes more common practice. You're coming into the profession knowing kind of what that integration can look like and having that experience already. Whereas law offices or public defense offices that are bringing that in later, there's a learning curve. And you know, a steeper learning curve in the sense that, you know, they have to kind of reframe how they're doing their work and have to kind of figure out what that integration looks like, and that can be a barrier sometimes. Yes, also happy to talk, Scott, if you would like. That's really cool that you're doing that work.
If I could also just add one thing to the internal versus a consultation, and at least in Arizona, we actually were having this issue because social workers are obviously mandatory reporters, just
Right.
with their licensing. The Arizona bar ethics panel just recently released an opinion, I think it was probably 2 years ago or a year and a half ago, during the middle of COVID, that if a social worker is an employee of the law firm or of the public defender's office, that they are not a mandatory reporter of things found during their consultation, which I think is a huge. It was important for us. We were having this issue of hiring social workers that we didn't want to be mandatory reporters as they're working with them. So I would also just add that I don't know that every state is that way, obviously, and I think that that's something important for each state to figure out. But I just wanted to point that out because I think it was a really big thing for us to have declared by the bar. So.
That's a huge.
That's huge. Yeah, that's an excellent point, Paul. And definitely, I know in New York and in California, for social workers who work in public defenders' offices or are considered part of the legal team, they are not considered mandated reporters. So yeah, that definitely alleviates a lot of the concerns for the lawyers as well as for the clients, because oftentimes our clients have had really bad experiences with social workers. So the thought of, you know, hearing the word social worker can freak someone out, right? And so being able to really come in and explain our role as part of the legal team and being there to support them and their needs, and not being part of these other oppressive systems that have been unjust to them in the past is really important, and especially for establishing reform and building that relationship.
Well, folks, this has been enriching as ever. Thank you so much to our presenters. And while we are actually going to keep this room open for people to just keep talking, but it is also the time on the East Coast when we all start turning into pumpkins. And I certainly want to relieve our presenters of needing to keep answering questions if they also need to go. Thank you so much. We will, of course, gather again tomorrow, but this has been really a tremendous first day, and it's been great to see folks and learn about all this new work. I've enjoyed it. very, very much. As I say, this is not the end even of today, but I just wanted to give people permission to go if they needed to. I think the other thing I will do is turn our recording off so we don't feel quite so surveilled also.